The lumbar spine starts in extension and will move to anatomical position, which will cause a flexion motion. The tension is concentric and will use the bilateral rectus abdominis, bilateral internal oblique, and bilateral external oblique. The hip will start in extension and end in anatomical position, which will be a flexion motion and a concentric tension. The muscles used will be the sartorius, tensor fasciae lata, rectus femoris, iliopsoas, and pectineus. The left knee will begin in extension and go to anatomical position, which will be a flexion motion. The tension is concentric and will use the semitendinosus, semimembranosus, bicep femoris, and popliteus. The right knee will begin in flexion and end in anatomical position. The motion is extension and the tension is concentric. We will use the vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. The left ankle will begin in anatomical position and end in anatomical position, which will result in no movement. The right ankle will begin in plantar flexion and end in anatomical position. The motion is dorsiflexion and will be a concentric tension. The muscles used are the peroneus tertius, anterior tibialis, extensor digitorum longus, and extensor hallucis longus. The left toes will begin in extension and go to anatomical position. The motion will be flexion and it's a concentric tension using the flexor hallucis longus and flexor digitorum longus. The right toes will begin in flexion and end in anatomical position, which will be an extension motion with a concentric tension. The muscles used will be the extensor digitorum longus, extensor digitorum brevis, extensor hallucis brevis, and extensor hallucis longus.